you guys should have this for looking at. Look at. Does that? Can you see where your what's that axis or atlas is crooked?
Oh yeah, yeah.
Okay.
It's tilted.
Yeah.
Yeah, rotated.
And we can go through all of your.
I got to get this for the office. Yeah.
No, I'll put this on a CD for you. Okay.
No, I mean this whole system. Yeah.
All right. So your throat. Janae,
Huh?
how come we didn't go down as far? Oh, I guess we did. I'm just not getting the whole picture here. Well, let me go to sections. Okay, I'm going to switch things, but can you see what you can see from this? Can you see what you can see
Oh yeah.
from this just of, look at it. I mean, you don't have any images that are this good.
No way. Yeah.
Okay, and that's just top to bottom. We can go front to back and side to side also. And you can see the facets, you can see rotations, you can see all kinds of stuff. So you see we're collaborating. You send them here, I'll get you these, and you can go through them with the patients. Now let me go up to sections. Okay, so now this is side to side, ear to ear, nose to the back of the head, and top of the head to the chin. All right, so now let's go through, and this is the sequence I go through with every patient, is I start by looking at the condyles, and the condyles are right there, and there they are in the fossas, the temporal bone fossa and the mandible. So this is the temporomandibular joint, looking at it from top to bottom. And what I look at is where is the condyle in the fossa, and it should be slightly forward rather than displaced backwards. And the first thing I notice is that this one looks good, and this one looks like it might be a little bit further back, displaced. So my guess is that you are rotated to the left. Your bite is rotated to the left. Okay, so that's looking at it from.
I need my nasal septum is uneven.
We're going to get to that.
Yeah.
We're going to get to that. Okay, so now we go down here and we're going to look at the condyles, and it should be nice and rounded and chicken boned, and you got a nice round condyle on this, and the space looks good. And then on this one, you're flatter. So this is the right side. But can you see how that one isn't as round, and it has kind of a flat facet on it? Well, that's from clenching and grinding. You can also see now, look at the vertebrae from this dimension. Isn't that amazing?
The left side is a little degenerated more.
Well,
Right.
the space is closed down a little bit. But you can see all this stuff, and there's nothing
else that can do it.
that shows you that is simple with as little radiation as this.
Exactly.
This is like 2 to 10% of what a hard CT medical scan is.
Yeah.
Okay, so we're looking at the condyles from front to back, and now we're going to look at them from side to side. From side to side, and here it is in the fossa. So temporal bone, mandibular bone, temporomandibular joint, and we can go right through that, and you see how it's displaced distally? The space in back, it should be further forward, and so this is your left one, and it's
Bless you.
it's displaced backwards. Now, what causes it to be displaced backwards is your front teeth didn't go out as far as they needed to go because of growth and development. And that's where the orthodontist actually does a disservice by retracting the front teeth to make them look nice, when what they should do is buck them out and then let the face grow out
Oh yeah.
to accommodate, and let the mandible grow out. And then the mandible actually grows longer, and it drags the tongue out of the throat. So the basis of sleep apnea is underdevelopment of the maxilla during childhood, early childhood. Okay, so now we looked at that one. Now let's look at
You
the
have
others.
to maintain, what's that, the Fibonacci triangle? The Italian anatomist who figured out there's a symmetry in the face.
Yeah.
That should be made.
Now see how this one kind of turns really far forward, and so your growth and development accommodated this tooth, holding this tooth back. When the whole maxilla, this tooth should have been a 1/4 inch to a 1/2 inch further out, and that is almost endemic in Western civilization because of our dietary changes. All right, and this goes back to Price Pottinger, and now we can look at it all 3-dimensionally. So your condyles look good, but they're displaced distally, and we could see that from the top, we could see that from the sides, we could see that from the lateral views. Now let's take a look at your sinuses, and your sinuses, here are your maxillary sinuses, and that's the way they're supposed to look. They're supposed to look clear as a bell with very thin membrane on the bone, and as we go down through them, your sinuses are clear. And we only see that in about 20 or 30% of the sinus.
Well, most people are.
Yeah, most people have got
jammed up. Huh?
Yeah, are jammed up, and they got fluid and stuff in them. So now let's look at them from front to back. And here they are, and you can see that you can see the sinuses, and this is the maxilla, and that maxilla actually needed to be another 1/2 inch wider. And when you look anthropologically at skulls from 100 years ago or 200 years ago, they were wider, and they've gotten narrower. And that's why Caucasians don't win marathon races anymore, because the Kenyans and the Ethiopians who eat hard foods, they have wider molars, and therefore their nose is bigger, and it works for air and
better oxygen, better VO2 max, because you're getting more oxygen.
They run the entire marathon with their mouth shut.
Wow.
And while they're breathing through their nose, they're producing nitric oxide, which gives them better circulation.
Dilates the blood vessels.
Dilates the blood vessels and blocks inflammation. And so they run the whole race with their mouth shut, comfortable, oxygenated, with increased vascularity and decreased inflammation from the
superior
race.
efficiency of oxygen utilization.
We're never going to beat the Kenyans and the Ethiopians in distance races until we start raising children that can breathe through their nose.
There you go.
Okay, so there the sinuses are from front to back, and as we come forward, now there the teeth come in, and can you see how this X-ray can show an abscess that you couldn't see at all
Wow.
in conventional? And so when we're looking at these, we can see teeth that have died that we have no idea that they've died. And as a matter of fact, there's the root canal tooth, and you can see that the root canal filling goes all the way to the end. Well, you can't see this view on any other X-ray.
Now, why is that bright versus this?
This is metal or filling material inside.
All right.
Okay, and then as we go through the sinus, you can see that your sinus floor is clear as a bell, and so you have very clear sinuses, unusually clear sinuses compared to what we see. Now we can look at the sinus from the side, and again you can see the teeth sticking up into the maxilla, and you can see the root tips, and so you can see abscesses, and you can see root canals, and you can see if they're done well, and most of them are contaminated. All right, so this is a view, but you can see the sinus, and the sinus is clear as a bell, and you can see how an abscessed tooth could cause a sinus problem, and a sinus problem could cause your tooth to hurt, because they're the same thing.
Yeah.
So now let's go over to the other one, and the other side, again, clear as a bell, nice healthy roots up into the sinus where they should be, with no infection in either above them or below them. And you just can't get these views anywhere else. And then down here, let's look at this. This is the root canal, and see, and there's
So
nothing.
you can see the hard tissue and some of the soft tissue.
You can see everything because you can cut through it three-dimensionally.
If you injected fluid, would you see the fluid? You know?
No.
Okay.
I mean, you'd see a space, but it
Alright.
would be hard to differentiate. Okay, so that's the sinuses. Now the next thing, and you wanted to jump to this earlier, is let's look at your nasal septum. Now everybody says I got hit in the nose, that's why I have a deviated septum. But in actuality, what happened is this I-beam from this point to this point was supposed to is the right length, and it's in a space that's a quarter to a half inch too short. So what does it have to do? It has to deviate. And so this is the deviated septum from front to back, and it's almost universal in our finding. Okay, and as we go from top to bottom, looking at that septum, you can see it looks like you got two cement trucks parked in your nose. So you think you can breathe through that? You can when you're vertical.
Okay.
You can when you're using your scalenes and your neck muscles, your shoulder muscles, your intercostals, your diaphragm has the.
It's a Halloween pumpkin. Huh?
Yeah.
That's sad.
Yep. Your diaphragm works when you're vertical because your visceral organs fell away from it and allow it to work. But when you lay down, your visceral organs come right up against your diaphragm, and your brain shuts off your neck muscles, your shoulder muscles, and your intercostal muscles, and your abdominal muscles. So when you're vertical, you can breathe through that nose if you try. But it's actually easier for you to breathe with your mouth open in a head-forward posture. And that's why you have the head-forward posture, and that's why from the time I was a little kid, people said, shut your mouth, you look stupid. Well, guess what? I was breathing through my mouth because my nose didn't work. And you know, stand up and don't roll your shoulders. No, I have to hold my head forward so my throat opens up. It's airway accommodation for survival, and everybody my whole life said it was poor manners and poor posture. No, poor posture and poor manners are survival mechanisms of children.
So you can breathe.
So that you can breathe, okay? So you can see the turbinates the turbinates are swollen. And if you were to breathe through your nose with breathe right strips and with a CPAP or with taping your lips shut through the Buteyko breathing method, you could shrink these membranes just because breathing through your nose produces nitric oxide, which shrinks those membranes. And nose breathing is what does that. Okay, and so how do males that can't breathe through their nose get around that? Running marathons, riding bicycles, doing killer workouts. They breathe through their nose in exercise, and it shrinks the membranes and makes them feel better and produces cardiovascular protective nitric oxide. All right? So it's not about cholesterol, it's about breathing through your nose. Is one of the areas that produces tremendous amount of nitric oxide, which protects you cardiovascularly from...
dilates the blood vessels, increase circulation.
Okay, so that's looking at it from front to back. Now let's look at it from, that's looking at it from top to bottom. Now let's look at it from front to back, and this scan doesn't go up high enough, but there's the tip of your nose. And as we go back, look at how quick it gets swollen. And you can see why you're a mouth breather. I'll guarantee when you sleep, you're a mouth breather. All right? So that's the nasal. So now we've hit the condyles.
Sometimes I do wake up in the middle of the 2, 3 a.m. for no reason.
And by the way, it gives you bad breath because you're oxygenating all the bugs in your mouth.
Bacteria.
Okay. So we looked at the condyles, we looked at the sinuses. Now we looked at the nasal triangle, and we looked at the nasal triangle from top to bottom, and you can see how the width of the teeth, if you just separate the teeth another ½ an inch, you drop down the palate. You have a broader lower palate, which increases the size of the triangle. This is the palate sticking up into the nasal breathing area, and if you separate the teeth during growth and development, the triangle doubles in size. All right, so you have 3 bedrooms worth of furniture in a 1-bedroom apartment.
Okay, where's that triangle to this relation?
The triangle is from here to the base of the skull.
Okay.
And so that's the triangle. And so separating the triangle makes the triangle bigger in this dimension and allows you to breathe.
Yeah.
Okay? The other thing is from front to back, when your nose grows out further, it opens up the triangle in this dimension and allows you to breathe.
And a lot of people develop COPD. They're not getting enough oxygen, so they get on oxygen, and then there's less oxygen going into the lungs.
COPD may be a result of apnea pulling up pepsin out of the stomach, aerosolizing it, and the COPD is a reaction. Asthma and COPD may be a reaction in non-smokers to pepsin out of the stomach that is a secondary problem from apneas, which are because of the tongue, which we haven't gotten to yet, okay? But you open up airway and asthma goes away in children. You open up airway, nasal breathing, and tonsils. You can reduce the size of tonsils 50% in 2 or 3 weeks. You open up the airway and children don't get inner ear infections, and that's because off the back of this are hamular notches. They're little bones that sling muscles, and those muscles, if you don't get the separation of the maxilla early, those muscles go right across the eustachian tubes. So if you separate the palate in infants through breastfeeding, through development of the tongue, a healthy tongue without tongue ties and without frenum attachments, and a nice flat palate, it pulls the muscles off the eustachian tubes. These kids never get the inner ear infections that cause the first antibiotic use, which then screws up their biome and their immune system, and sets them up for all kinds of allergies the rest of their life. And so the early intervention of this, and you're late stage, so we can't grow you and develop you further, but if you get to children and infants, you can correct all these things through growth and development, and through myofunctional therapy, and through training to let the system grow the way it should have grown if we hadn't had liquid calories, free flow baby bottles, and pre-digested foods, and that's why they're calling all these conditions and diseases of Western civilization. It's because we don't get the proper growth and development from the time we're born.
We're not eating hard foods like we're designed to.
Foods.
Yeah.
Mom's good cooking, you know. Anyway, so now let's go back to the last thing. So we looked at condyles, we looked at sinuses, we looked at septum, we looked at turbinates, we looked at swollen tissue. Now the next thing that we're going to look at is the throat. And so now here we are at the tongue, and you can see up here you got some pretty good space. But as we go lower, look at this, the shape of this. So if this is vertical, think of what it is when you're horizontal and your tongue comes back and your jaw relaxes, and this thing shuts right off. You're probably apneic in your sleep.
Yeah, that's why I'm waking up at 2, 3 a.m. a lot of times, huh?
Yep, and that's why
because
you have
to kind of have to breathe to live, right? The body wakes you up.
Your body is saying, breathe, stupid, or you're going to die.
Yeah.
And that's not your fault. That's your brain trying to keep you alive. And by the way, that's when you have to use the restroom. You don't wake up because you have to use the restroom. You have to use the restroom because your brain woke you up.
Oh, okay.
All right?
Yeah.
You don't sleep light because light bothers you or noise bothers you. You sleep light because your brain woke you up and then you noticed that the light was on, or you noticed there was a noise in the background. And so people think they wake up because of noise and light and they have to go to the restroom. And in actuality, they notice those things because their brain woke them up because they weren't getting enough oxygen.
Okay.
And it was a 911 call.
Yeah.
Wake up and breathe, okay? And when you wake up, you start a peristalsis, you clench your teeth together. That's what causes all these dental problems and recessions and periodontal disease and fractured teeth and sensitivity in teeth. So you clench your teeth together in a death grip, pull your tongue out of your throat, start a peristalsis, stiffen your throat, you get air, repeat cycle. And you're exhausted all the time. And so the biggest argument I have with people that are sleep fragmentation deniers, which is 100% of the population, I sleep just fine, is you argue with them that they sleep just fine and they don't need you to look at any of this stuff. You know, how are my teeth? Well, guess what? You're beating your teeth up because you have a sleep fragmentation problem, and the reason you think you sleep so well is because you're exhausted all the time, and the reason you have so much stress is without that stress you can't get your brain to function, and without the stimulants you can't get your brain to function. And when you do that, then you need alcohol or drugs to go back to sleep at night because you're overstimulated. And if you got good sleep, you wake up and you feel great in the morning, and you're tired at night and you go to sleep and you get a night's worth of unfragmented sleep. And the vast majority of the population has never even experienced that. All right? And how does that segue into teeth? You beat teeth up, you have sensitivity, you need root canals, you have periodontal disease, you lose bone, you get temporomandibular joint problems and headaches and neck aches. And it all starts in infancy with obligatory nasal breathing. You need to be able to breathe through your nose to be able to nurse and breathe. And infants that can't breathe through their nose because their palate never flattened out, or their tongue is tied, or they have frenum attachments and they can't latch, those are the colicky babies that are difficult on the mother. The mother thinks it's their fault. It's actually the palate and the tongue function problem that can be easily corrected.
Yeah.
Okay? And these are the little boys, the little kids that grow up ADD and ADHD, and they have swollen tonsils and they need ear tubes, and they have recurrent infections and allergies, and they bedwet. Bedwetting is the brain waking these children up in the middle of the night to breathe, and they think it's morning, and so they pee. Okay, it's not a behavioral problem.
Yeah.
It's a sleep issue. So is all this stuff fitting together?
Yep.
Okay, now let's look at your throat from the side, and you can see right there. That's your choke point. That's your choke point, and that's with you vertical. Imagine what happens when you relax and your tongue falls back in your throat. So you are I can predict that you have apneic events just based on the size of this and the size of this. And we have a little tool here that we can do. Okay. And you have opening of 122 millimeters. You should have about 160, but it's not just the size you have, it's the shape, and your shape is much more likely to collapse than someone who may even have a smaller area but is circular. So the flatness of the airway allows it to collapse better, and you're below what we would like to see. So your molars should be a half an inch further out, and your front teeth should be quarter to a half an inch further forward, and that would drag your jaw.
But because of all the orthodontics I had in the 80s,
They actually moved everything back.
Yeah, okay.
They actually made everything worse. They made your teeth straight. They made your mother happy, but they compromised. They did it at a compromise of your airway. They didn't understand that the teeth's primary goal, primary duty is to maintain airway first. And then it's to chew with and to smile with and to do all the things that we use our teeth for. And we have...
So eventually it would have balanced out. My lower jaw would have grew forward with the front.
No, you probably would have needed lateral expansion because if the jaw is too narrow, it's like trying to put your foot in a too narrow shoe. You can't get it to the toe. But if you expand the mandible, then the foot goes all the way forward. Well, when the foot goes all the way forward, it drags the tongue, because the tongue is attached to the back of the mandible, so it drags the tongue forward and it drags it out of this. See these teeth? The upper teeth actually hold the lower teeth in place, and so if you move the front teeth out this far, the mandible comes forward and the tongue comes forward the amount of distance.
Opening up that airway,
Yeah. So you have a three-dimensional problem. The three-dimensional problem is that the molars need to be spread, and the upper front teeth need to go out further, and then that allows the mandible to come forward and keeps the upper teeth from rotating down too far. So,
but since I'm now almost 50, I mean, it's pretty much set. There's nothing we can do to expand that, huh?
That's right.
All right.
So you're most commonly a CPAP.
Okay.
Okay, and you could have orthognathic surgery, and some people actually need orthognathic surgery to overcome this, but for you, a $1,200 device.
That's probably why I like to sleep on my stomach, right, to open up the airway.
That's right.
Okay.
That's right, and that's why people have shoulder problems.
Yeah,
is
impingement.
They sleep on their shoulder, and then when their shoulder gets sore, they rotate to the other shoulder, and that allows their tongue to kind of sag off
Get out
to
of
the
the way.
side instead of sag back. But then they have problems when their shoulder finally gets sore and they can't sleep on one side, and when they rotate to change their airway position, it wakes them up because of shoulder pain. That's what causes shoulder pain in older patients most of the time. It's not playing tennis. It's sleeping on one shoulder and the other and then getting a sore shoulder. All right, so you see how all this stuff fits together with teeth?
Yeah.
Teeth and growth and development, and you can't separate the teeth and the airway from the body or the neck or the shoulders or the ankle bone's connected to everything. All right, so does that make sense?
Yep.
So next thing for you is high resolution pulse oximetry. We'll have you wear that for 5 days, and we actually see what happens to your heart rate and your oxygen level when you sleep.
I could even videotape myself at night and film me struggling breathing before I wake up at 2 or 3 a.m., right? You should be able to see that interruption in breathing patterns, right? If I record myself.
That's what every parent, we had this discussion, every parent and grandparent should be videotaping their infant children and their small children in their sleep to see if they're snoring, to see if they're apneic, and you can just watch their stomach go up and down when they choke off, and that's the dysfunction that pulls stomach acid and pepsin out of their stomach and aerosolizes it, and then gives them asthma, and it gives them swollen membranes. When you aerosolize pepsin out of the stomach at night because you choked off, that's swells up all the membranes, tonsils and adenoids and nasal membranes, and it gives them asthma. So if Butico method is you tape the mouth shut, get children sleeping through their
breathing through their nose.
Breathing through their nose, tonsils and adenoids shrink, and asthma goes away. That's the way they treat it in the former Soviet Union in Russia. Okay, they don't give these kids. They're not asthmatic because of pollen.
Bronchodilators and
they're asthmatic because
antihistamines.
they're
Here it's all pharmacologic. How can we fix this
they're
with
asthmatic
pharmacologics?
because they're aerosolizing pepsin, digestive acid in the stomach. And my suspicion is these COPD patients are chronic apneic patients who are chronically breathing in digestive enzymes into their lungs every night.
Mm-hmm.
And guess what it does to the function of the lung?
Yeah, it's disintegrating all the tissues.
And so it's the problem is you got to go back to causation, and everybody's treating
symptoms
instead of, and people with symptoms, you have to be treated, but the key to surviving the financial costs of these car wrecks is to go to the beginning and develop cars that do not get into accidents.
There you go. And this concludes our first podcast with the world's leading innovator in discovering what is the root cause of sleep apnea, any type of dysfunction with the sinuses, breathing problems, all starting with abnormal development of all the structures of the jaw, the teeth, not eating hard foods to develop the normal jaw growth patterns, causing airway obstruction and a host of other diseases, bacteria getting into our systemic system through improper dental work. So here we have Dr. Greg Vigerin, and this is our first official podcast, okay?
And to recap, with young children, bedwetting, difficulty breastfeeding,
colic,
inner ear infections, colicky, ADD behavior, head forward posture, mouth open, breathing and eating. These children eat with their mouth open because they have to breathe at the same time. They can't breathe through their noses. Okay, so when you can't breathe through your nose, it's because you didn't get the proper development of the arch, and so now orthodontics is going all the way to infancy and early childhood to correct this. And those children who have early intervention and correction, which is primarily through myofunctional training, in other words, training the tongue how to work properly and the position of the tongue, these children avoid orthodontics, they avoid inner ear infections, they do much better in school, they have much better energy levels, it avoids asthma, it avoids early antibiotic infections that require antibiotics, and it sets them up for a whole lifetime of being able to sleep, not being apneic.
Perform better in school because you get more oxygen to the brain cells.
Perform better their whole life.
Yeah.
And it shuts off 25 end-stage diseases that society can't afford.
And of course, not to mention sports performance because you get more oxygen to the lungs and muscles. There you go. Well, here we have it, folks. And again, just contact Dr. Vigerin here in Newport Beach, California, to get not only your dental, your breathing needs, your lung, your myofascial, your structural needs for any type of craniofacial maxillary diseases or disorders. Starts with your children. The younger the better, so they could develop normal dental structures. Just give them a call. Thanks for watching.